Hello everyone, welcome to Aptly Plus Academy for Civil Services, and I welcome you all to the learning series via News in Focus. Today's topic is WHO International Classification of Disease, something very important for prelims examination. There was a recent event took place in Delhi, so it is important for you to know the other details about the International Classification of Disease. And before I start, the important fact that you need to know that WHO is a one organization which actually come up with the classification of disease. This can be an important question for many other competitive examination. So let's get understand and let's start that session to understand about the international classification of the diseases. So recently, the World Health Organization, the International Classification of Disease 11TM Module 2, comorbid code, the codes was actually launched recently in Delhi. So this is International Classification of Disease by the World Health Organization. Now, the other details about the international disease classification, if you look at the part of the important details which is there with regards to the international classification of disease. So it is a global health information that come up with the standard details of the morbidity and the part of morbidity statics, right? The first international classification of edition is known as the International List of Cause of Death, which was adopted in 1893, and this was known as international. This was there by the International Statistical Institute. So, ये organizations थी, they have come up with a complete detail. Now, WHO has also instructed with the part of ICD in the creation by 1948. And ICD was revised periodically, and currently it's a 10th edition that is ongoing. We have come up with the 11th part in the recent one. The ICD is increasing the use of clinical care research, define करती है with regards to the study of disease pattern, well managing healthcare, monitor outcome, and even allocate the resource that how we need to come up with the detailing the procedures, the SOP that is mandatorily required. ICD has also come up with the translation in 43 languages to understand the countries concerned, the region specific, so that they have a better understanding about the norms, the SOPs, and the guideline which is released specifically by the part of WHO. Now, ICD की पर्पस क्या है और किस चीज में ये यूज की जा सकती है? The ICD is a foundational for identifying the health trend and statistics globally. It helps us to understand with a better understanding of the global health concern and the priority that need to be set. It is an international standard for defining and reporting the disease and healthcare condition. It allows the world to compare and share health information using a common language. ICD defined universe of diseases, disorder, injuries, and other related healthcare conditions as well. Now, some other details about the ICD, it actually come up with entitling and listing the comprehensive way to everything that is covered. As I told you, the 11th edition is there. Or organization जो है, it also organizes the part of standard grouping for disease that allow for easy storage, retrieval, analyzing the health information for the evidence-based decision making. This is the one. Second is sharing and the complete health informations between the hospital, region, and setting countries, and even for the part of other region which is specifically there. The data comprises of the same location across different time interval. So it gave a better and holistic picture for a country concerned to understand the trend, the diseases, the patterns, how they can overcome, what are the combating measures, how they can take the preventive actions. All the things are there in the detailed discussions. And the other details about the ICD 11 is first, it's called for the public health cause for death, clinical terms of record for surveillance, functioning assessment of the decision report, primary care, prevention and research, patient safety, drug safety and device safety, and last but not the least is the case make costing resources known as DRG and cancer registration. Now, this was all about the ICD 11, something brief about WHO as its functions and what are the core functions of WHO. This can be again relevant for prelims. First, it's called for providing the leadership on the matter related to health and engaging, partnership where the joint action is needed, shaping the search agenda जो कि stimulate करती है in terms of translations and even giving the valuable knowledge, setting norms for standard जहाँ पे promoting and monitoring and the implementation is taken care of, articulating ethical and evidence-based policies options, providing technical support. WHO even come up in assisting with the part of technical support, catalyzing the change and building sustainable institution capacity. This can be a direct question in the prelims examination, the statement of MCQs. And last but not the least, it monitor the health situation, assessing the health trend across the globe, right? So these are some of the major and core functions of the WHO. I have also talked about ICD. Hope this topic will help you specifically in the prelims examination. I'll be coming up with such more informative videos in this session. For time being, I'm signing off. Thank you so much for watching. Thank you for staying tuned.